Hello and welcome everyone to October's Power Hour, Guide to Medicare. My name is Stephanie. I know you guys were probably expecting Greg for today, but I decided to give him the day off. So you have me and Rob Charnas presenting today. I am one of the client care specialists here at Hammond Iles. If you're a current client, you may have heard from me to book your yearly meetings. But if you're new and interested in scheduling a meeting and seeing how we can help, you can email hello@HIWealth or give us a call at 800-416-1655. I'll include all of that in the chat, so no need to remember, but you can always reference the chat if you need that information. Here at Hammond Iles, we are a lively online community bringing generations of families together to experience freedom and fulfillment. Like I was saying, you can direct your questions to the chat. Questions are always encouraged. We'll do our best to answer at the end. And here's Rob Charnas. We're going to talk about Medicare Made Clear, what you need to know and understand about your benefits. Rob Charnas has joined us for previous Power Hours before. He specializes in health protection for seniors through Medicare supplements and prescription advantage plans. He's ranked as a premier agent, the highest level of Medicare specialist at United Healthcare and AARP Medicare in Connecticut and the United States. Mr. Charnas helps families and businesses plan for often devastating financial and emotional consequences of illness and disability. So Rob, go ahead and take it away and let them know everything we need to know about Medicare.
Thank you, Stephanie.
You're welcome.
I'm going to bring up my presentation. Good. I hope you all can see it. First, I want to say how much admiration I have for those of you that are joining us today. There are 44 million people on Medicare, and just a tiny fraction take the trouble and time to go to a workshop, a seminar like this. And the result is many of them make mistakes. They don't understand that they get the wrong plans. So you are really in an elite group, and I'm very pleased to welcome you. I have been doing this for so many years, I can't remember how many for Hammond Iles, and I'm always honored they ask me because they're one of the top financial advisor firms in Connecticut. So I am very, very pleased and honored to do this year after year. When I used to do it live before COVID made things virtual, people would come in to the room with about 3 pounds of letters that they'd received in the mail over the last few weeks, all about different plans, different insurance companies. And the more mail they got, the more confused they were. So learning about Medicare is a little bit like learning a new language. You start with words, then sentences, and then you become more fluent in time. At United Healthcare, we try to simplify this through our Medicare Made Clear program, which we're doing today. And we hope you'll walk away with a new vocabulary, a clear understanding of what Medicare is, how it works, and most importantly, how it could work for you. To illustrate how difficult sometimes it is to understand Medicare, I'd like to tell this cartoon I saw in the New Yorker magazine. It showed 2 old men on clouds in heaven with their wings, and one said to the other, "The only regret I have is I was just beginning to understand Medicare Part D." So the whole world knows that Medicare is a bit complicated. I'd like to start with an overview before I go into the details. And the overview is this. In 1966, the government invented Medicare. And it came up with two parts, Part A, which is hospitals, Part B, which is medical. But A left a $1,600 deductible every time you'd go to the hospital. Part B only covered 80% of medical expenses. So they knew that that was too expensive for the population, and they created something called Medigap policies. And those are now called Medicare supplement policies. And it found some insurance companies who were willing to offer these. The health services were all the same, depending on what, regardless of what company. But the prices were different and left up to those companies to charge. And those paid all or part of the $1,600 deductible on Part A and the 20% gap for Part B. So this went on for 20 years, and drugs, which started out in 1966 as pretty inexpensive, went through the roof. The government realized it needed to help with Medicare drug plans, or Part D. So it invented those. And so people who had Medicare supplements then added a Medicare drug plan, and they had help. However, the cost of the supplements was $200 or more a month on average. The cost of a drug plan was anywhere from $30 to $150. And that proved too expensive for many, many American families. So the government invented something called Medicare Advantage plans, a Medicare Part C. And those, because they were subsidized by the federal government, could often offer a premium of zero and have small co-pays for use of services. That happened another 10 or 15 years after drug plans were invented. And today, those are the most popular plans, over 4 million. And United Healthcare is the leading provider in the country of both Medicare supplements. They're mostly AARP, which is part of United, and Medicare Advantage plans that are both called AARP or United Healthcare. How do you know what to choose, whether a supplement or an Advantage plan is right for you? That choice is primarily based on your health. For people who have serious health conditions, who expect in the next year to have some hospitalizations or expensive tests like MRIs and biopsies, will tend towards getting supplements. Supplements are expensive in their premium, $200 or more a month, plus the drug plan, $300 or more a month. But after you pay that, most of the plans have all the health services without charge or with very minor copays. So there's also no network. And any provider, hospital, doctor in the country that accepts Medicare has to take a supplement. So they cost, a minimum of $2,000, $3,000, $4,000 a year, even if you don't use medical services. The Advantage plans, on the other hand, can save $2,000 or $3,000 because the premium is zero. The copays, except for hospitalizations and expensive tests, are minimal. A typical person would pay no premium, $300 or $400 in minor copays for doctor's visits and things like that. If you're healthy and not expecting that, a great deal of use of hospitals and tests, Advantage plans are really the right ones for you. Some have networks, some allow you to go in or out of network. Some are local in their coverage. Others, like United Healthcare, are national, very similar to Medicare supplements. So that's the basic difference and the basic choice. If you have a lot of serious health conditions, you might want to supplement. If you're quite healthy, doesn't have to be perfect, but if you're quite healthy, then you probably want an Advantage plan. So we'll move on now to some of the details. The questions we're going to be covering is, what is Medicare? Who can get it? Do you need Medicare if you work past 65? What does it cover? Can you get more coverage? What does it cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? So we're going to get to know Medicare through this Medicare Made Clear program. What is Medicare? It's a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you paid for years while working, and it's individual health insurance. In other words, it's not a family plan. It's not free. It's also not Social Security. Some people confuse it. And it's not Medicaid, which we'll get into a little bit later. What is Medicaid in contrast to Medicare? It's a state government program, helps pay health care costs for individuals, family, and children who have limited income and resources. And the programs vary from state to state, and eligibility varies from state to state. And we'll get into that in a little more detail. If you have Medicare and Medicaid, it's called dual eligibility, and open up the opportunity to get additional benefits and free plans. And we'll cover that a little bit more a little later. So who can get Medicare? You have to be a U.S. citizen or a legal resident. If you're a legal resident, it has to be for at least 5 years, and those 5 years have to be just before you apply for Medicare. And you have to meet one of the following 3 requirements. Age 65 or older, younger than 65 with qualifying disabilities such as Social Security, disability income, or any age with a diagnosis of end-stage renal disease or ALS, which is known as Lou Gehrig's disease. Can you have Medicare and Medicaid? Yes, you can have both. You become dual eligible, and they can work together to lower your healthcare costs. Connecticut has a program called the Medicare Savings Program. It's run by DSS, Department of Social Services, and it offers many benefits. The most beneficial is if you can qualify for what's called QMB, the Qualified Medicare Beneficiary. It allows you to get a United Healthcare plan called Special Needs, and everything is free, and it offers thousands of dollars of additional benefits. However, you need to have a monthly income, if you're single, of $2,564. If you're married, $3,468. My guess is that if you're a client, as you are, of Hammond Iles, your income is far in excess of that. However, I mention it because you may have friends or relatives that fall into that category and can benefit from the Medicare Savings Program in Connecticut. And they can certainly call me. At the end, I'll be giving you my phone and email. They can contact me if they want to see if they are eligible, and I can help them apply and get accepted by these programs. Do you need Medicare if you plan to work past 65? It depends. Part A of Medicare is free. And so you'll get that when you're 65, and there's no penalty if you do. Part B can cost you a fair amount of money each month. So if you have employer insurance, typically you'll accept Part A from Medicare, but not B. If you're getting Social Security, you'll automatically get a card which gives Part A and B on it, and you have to opt out of Part B. So you're not paying for your company insurance as well as the premium for Part B. But once you leave your company in health plan, then you can, within 63 days, get a Medicare Advantage or Medicare supplement, no penalty. And as long as your plan and your employer plan has 20 or more employees, and the coverage is creditable, which means it's similar to any good plan, you can move ahead without a penalty. So I tell people if they have the employer plan, don't get Part B, but once they decide they want to leave it, they have to apply for Part B, and I help them do that. And that's the same for the spouse. The same rules apply. So this slide really is what I just described, except if you are even on Part A, you can no longer contribute to your health savings account, your HSA. You can, of course, if there's money in it, take money out and use it for health reasons. So if you are thinking of switching out of your employer plan, you have to consider if it covers your children, because Medicare will not. So you have to sort of look at that cost and see if it makes sense. So Medicare covers pretty much what I mentioned. Part A is hospital, Part B is medical. And here are some of the details. Your Part A hospital coverage covers room, meals, ICU, prescription drugs, medical supplies used in the hospital, lab tests of every kind, x-rays, equipment, operating room, nursing care, blood transfusions, hospice, and sometimes part-time skilled care for the homebound if you've been in the hospital for 3 days and 3 nights. That includes rehabilitation services after 3 days and 3 nights in the hospital. A, as I had mentioned, is premium free if you've paid taxes for 10 years or longer. You can't be denied it. Coverage is nationwide. Coverage and costs are per benefit period, which is 60 days. You have to be admitted as an inpatient, not an observation, which is important. So if you end up in the ER, you want to make sure that even if they give you an aspirin, they write down that you're there for treatment, not observation, so that you're entitled to the up to 100 days of rehab or nursing home care when you get out. Also, this provides 60 extra days, lifetime reserve days, which you can use for Part A. Part B covers doctor's visits, a wellness visit, laboratory services like blood and urine test, x-rays, MRIs, CAT scans, EKGs, a number of health programs, smoking cessation, obesity counseling, physical therapy, diabetes screenings, mental health care, durable medical equipment, and ambulatory surgery centers and ambulance and ER. Remember, Part B only pays 80%. You have to pay 20. There is a monthly premium adjusted for income. The current lowest is $164 a month. The higher your income, they look back 2 years to judge that, the higher that is. You can't be denied coverage. Coverage is nationwide. Any provider that accepts Medicare, and there is a premium penalty for late enrollment unless you qualify for a special election period, and we'll go into that in a few minutes. Original Medicare, Parts A and B, does not cover certain things. It may not cover all of your cost of care. It doesn't cover prescription drugs, dental, vision, hearing, eyeglasses, contacts, hearing aids. It doesn't cover long-term or custodial care. It doesn't cover excess charges for services by doctors who don't accept Medicare assignment, except in Connecticut, where we have a law that disallows doctors from charging excess charges. And it doesn't cover care received outside the US, except for certain circumstances. And some of our plans do cover that, some don't. So how do you fill those gaps? How do you fill the 20% gap in Part B and the $1,600 deductible for Part A? There are a couple of options you can choose, which I covered a bit in the overview. One, for drugs, you can get a standalone prescription drug plan, Medicare Part D, from an insurance company. You can also get a Medicare supplement, the one that used to be called Medigap, and that will pay some or all of your medical costs, including the deductible. Or you can choose Part C, better known as Medicare Advantage plans. They typically include Part D drug plans in that. And they also offer a great deal of additional benefits: vision, dental, hearing, gym membership. Some of them offer free over-the-counter drugstore items or food. There are many, many extras that Medicare Advantage offer. So these plans are still in the Medicare program. Benefits A and B are administered by the plan and subsidized by the federal government, all offered by private insurance companies. And I covered the last 2 points there. And they are all required from any insurance provider to cover the same health benefits. Prices can differ, and the extras can differ. And I covered the information here. You can take a look at it. There are different kinds of Advantage plans. One of the most popular are HMOs, Health Maintenance Organization plans. They typically have a network that you have to adhere to. Point of service plans are not that common, but they're with providers that agree to pay, to accept a service fee from your insurance company, but don't normally do it. Then the next most popular are PPO plans. They're like HMOs, except you can also go out of network as well as in network. And then there are special needs plans. Those are for those who are dual eligible, Medicaid and Medicare, typically, especially the special needs plan. They're chronic special needs plans and institutional special needs plans if you're in a nursing home. There's some very uncommon plans, fee-for-service plans, and medical savings account plans, which are very, very rare in Connecticut. Let's see. Okay, some quick facts. To keep your Medicare Advantage plans, you have to be enrolled in Part A and B. You can't be denied coverage based on financial or health. You may be required to use provider and pharmacy networks. Coverage and cost vary by plan and can change every year, which is why even if you're not new to Medicare, it's a good idea to go to these seminars or check with your agent and see what changes are in your plan, for the following year. There is something called an out-of-pocket maximum required in all, by the federal government, required in all Advantage plans, and that's a safeguard for you. They vary. Some of them are $4,000, $6,000. And what those plans mean, even though they're often misunderstood as deductibles, they're not. they're safety nets. If your copays and coinsurance ever equal that number, say 6,000, then everything after that is free. All right, so it's just a safety net giving you your total risk. I have hundreds and hundreds of clients, and to this day, none has ever had copays or coinsurance equal to their out-of-pocket maximum. It's usually much, much less. Every plan may or may not charge a premium. Many of the plans have zero premium. You have to continue to keep your Part B, Medicare Part B active and paid up to keep your plan. Now we're going to move on to Part D, which is prescription drug coverage. You can get a standalone plan, and you can get an Advantage plan, which has Part D built in. Those are your two options. It covers the types of drugs most commonly prescribed for Medicare beneficiaries determined by federal standards. They're both brand name drugs and generic drugs, and they're listed in their drug list, which is known as a formulary. And it does cover some commercially available vaccines that are not covered by Part B, which covers a number of vaccines. The formulary, right, lists the drugs that are covered, even though you can get exceptions on most plans. And during the first sort of, there are 4 stages, which I'll go over in your drug plan, but your second stage is a tier stage. And all of the drugs listed in your drug list have a tier attached to them. Tiers 1 and 2 are generics. They're the least costly in terms of their copays. Tier 3 is often brands or special generics. They're a little more expensive. Tiers 4 and 5 are specialty drugs, and those are even more expensive. So the more generic drugs you have, the lower your costs are going to be. Some plans have deductibles, often related to specific tiers. Some do not. The 4 stages I mentioned are these, and this is true no matter what company you sign up with. First, there's a deductible stage. Now, not every plan has deductibles, but if they do, you have to work through that before you get to the next stage, which is that tier stage called initial coverage, and you copays are based on the tier. When that reaches your total drug cost plus the copays, reach $5,030, you move into the third stage. It's the infamous donut hole or coverage gap. During this period, you pay 25% of your generic or brand drugs. 25% of generics are still very inexpensive. 25% of brand drugs can be costly depending on the retail cost of those brand drugs. You get out of the coverage gap when your total out-of-pocket costs, starting way back in January, reach $8,000, and that moves you into the final stage. That's called the catastrophic coverage stage, which I call the wonderful stage because it either has extremely low copays, both for brand and generic, or none, depending on the plan you select. Many people don't reach the coverage gap stage because they just don't use that many prescriptions. Everything starts over in January, and you go through the same stages again. Again, to keep your prescription drug plan, you have to stay enrolled in Part A and Part B. You may be required to use a pharmacy network. Coverages and costs vary by plan, can change each year, and there is a penalty for late enrollment unless you qualify for a special enrollment period. And we'll cover some of those penalties later. Now we're going to move on to Medicare supplements and get into a little bit more detail there. They, again, help pay the gaps in Parts A and B. Some of the plans pay all of them, some of them plans pay them partially. They work with original Medicare, in other words, the people have A and B, and they can get a separate Medicare Part D plan. Actually, they're required to get a separate Medicare Part D plan if you have a supplement, or else you get a government penalty. And they are unrelated to Medicare Advantages and can't be used for those costs. There are 10 plans that are standardized. All the companies, insurance companies that offer this have exactly the same coverage in terms of their health plans. The big difference is in what they charge. In one of the Hammond Iles seminars that I gave years ago, it was in person, and I mentioned that our plans, which are AARP Medicare supplements, typically are $170, $200 a month, that range. So this woman raised her hand and said she's paying $600 a month. And her plan was identical to ours, but from a different insurance company. So it's very important that you check the costs. And the Connecticut Insurance Department online, if you look that up, has all the Medicare supplement providers and all of their premiums listed. So you can compare the cost, knowing the plans are identical, except sometimes they offer some extras that might vary slightly, but the extras are not that significant with supplements. So I think I've covered what these supplements help pay for. It's everything that your Parts A and Parts B offer, where there's a gap, right? Hospital coinsurance, that deductible, nursing facility care, co-pays, blood transfusions. They do give you 365 extra hospital days to stay and cover that. Hospital care coinsurance, Part B deductible, is typically not covered. It's $226 a month this year, but it does cover the Part A deductible. Some of them give you foreign travel and emergency care up to certain limits. And some of the plans offer to provide payment for those excess charges that some doctors pay, but you don't need to do that in Connecticut. So they work with Original Medicare. Summary: they can't be used to pay for Medicare Advantage costs. 10 plans. They're labeled by letters A through G, and those describe what costs and services are covered by the plans. And Massachusetts, Minnesota, and Wisconsin have the only states with different rules. If you're moving to Massachusetts or from Massachusetts, you can give me a call and I'll let you know what the differences are. And they're all offered by private insurance companies. So plans may help pay all these different things which I described, but they don't pay for prescription drugs, routine dental, vision, or hearing, eyeglasses, contacts or hearing aids, custodial care, or long-term care. Now, this is the chart that takes each one of the letters. A and B are exclusively for people on disability, but the others are available. My clients and most, typically all, choose either Plan N or Plan G. I'm not going to take an hour to go over, what all the plans offer, but I will mention that Plan G in our world has about a $230 a month premium. And after that, all the health services are free. No copays, no coinsurance. There is a $226 deductible annual deductible with all of these plans. Plan N is a little cheaper. It's about $50 less, $170 or so a month. It's identical to Plan G, except it has a $20 copay for an office visit with a doctor and a $50 ER visit. Otherwise, you can save $50 a month with Plan N and still have your hospitals and tests and all those other things I went over completely free. You have to stay enrolled in Parts A and B to keep your supplement. There's no medical underwriting up to 6 months after enrolling at Part B at age 65. Connecticut, however, is one of the 3 states with guaranteed issue. So whenever you first apply for a supplement in Connecticut, which can be in any state, any month of the year, you normally will not have medical underwriting, minor exceptions. There's no network. You have national coverage. It's guaranteed renewable as long as you pay the premium. Premiums vary, as I mentioned, by the insurance company that runs the supplement. And you have to continue to pay Part B to keep it. So what does Medicare cost? There's the premium, the fixed amount that you pay for coverage monthly, that Part B, $164 or more. There may be deductibles in your plan or not that you have to cover before the plan kicks in. There are often copays. With Advantage plans, there are copays with almost all services. It's sort of like pay as you go, where supplements you pay, in a sense, upfront by paying a high monthly premium. Typical copays might be $0 to see your primary care physician, $20, $30, $40 to see a specialist, $15 for an X-ray. Lab tests typically are free or very low cost, blood work that you'd get at an annual exam. But, expensive tests like MRIs or biopsies can be anywhere from $90 to $130 or more. Some plans have coinsurance, which is a percent that you pay on the service. Advantage plans typically have a low to $0 monthly premium. Often will have a deductible. Our plans typically don't have a deductible. They almost all have copays for most services, and some have coinsurance as well. Prescription drug plans, Part D, there's always a monthly premium. There is sometimes a deductible, sometimes not. There's generally copays for all drugs, although some now low tier 1 drugs can be free. Mail order drugs are often free if they're a low tier, and there are some with coinsurance, some not. Supplements have a monthly premium, usually high. They all have that $226 deductible, and some have copays, some do not. Advantage plans have that annual out-of-pocket maximum, which I described as a safety net for you. And so how do you choose? If you have original Medicare, your choices are on the left here. You can stick with just those 2, leaving the gaps, or you can add a Part D drug plan, standalone, or you can add a supplement, or you can add a Part D drug plan and a supplement. And those are your choices with original Medicare. The alternative is a Medicare Advantage, and that will typically come with a Part D included. There is an ability to get a plan without Part D, and that's usually for people who get their drugs at the VA. And so they don't need an Advantage plan which covers drugs. So those are available as well. Right, so you have, I don't want to go through it all again, but you have original Medicare with a supplement, you have a Part D plan with or without a supplement, and you have Medicare Advantage plans, which are C and D combined in most cases. I have gone over the comparison of Medigap versus Medicare Advantage. But one thing I didn't mention is the convenience. With a supplement and a drug plan, you have to have 3 cards: Medicare card, Medicare supplement card, and your drug card. And so you need to show all three. With your Medicare Advantage plan, one card covers everything because that insurance company actually administers parts A and B and the drug plan. So it's a little bit simpler, and I've covered the other differences. When can you enroll? There is something called the initial enrollment period, IEP. That is 3 months before the month of your birthday, the month of your 65th birthday, and 3 months after. If you enroll during that period, there are no penalties. If you're getting social already, you'll often be pre-enrolled and sent a card by Medicare. If you are working and want to stick with your employer plan, you want to opt out of Part B, or you'll be paying the Part B premium plus your employer premium. If you want to get Part D, you have to enroll on your own. If you are not getting Social Security and you want Part B, you have to enroll. And you can do that online. The website is listed here, ssa.gov/benefits/Medicare. You can also do this by going to medicare.gov and look for enrollment. The best advice I have, and I see it's here, is to enroll in the 3 months before the month of your birthday, so your plan can start on the first day of the month that you're 65. There's something called the general enrollment period, and for those who missed their initial enrollment period, you can enroll in Part A and Part B in this initial enrollment period, January through March. You can choose to enroll in an Advantage plan or a prescription drug plan, Part D, in April through June, and your late enrollment premium penalties might apply. Your Medicare supplement open enrollment period, to avoid a penalty, is 6 months after your 65th birthday. And during that period, there's no medical underwriting, which there isn't in Connecticut anyway, but there is in other states. If you apply at other times, you could be denied coverage or charged a higher premium based on health, but that's typically not the case in Connecticut. So there are special enrollment periods, and the most common is you working past 65 and you have Parts A and B. You want Parts A and B. You have 8 months after you drop your employer plan to get Parts A and Parts B for Medicare. If you want an Advantage plan, you only have 63 days after you drop your employer plan to get an Advantage plan and avoid a penalty. So please remember that. 8 months for Parts A and B, but only 63 days for an Advantage plan after you drop your employer plan. The penalties. For Part A, you don't have a penalty unless you haven't worked for 10 years and paid your Medicaid taxes, your Medicare taxes. The penalty is 10% of the Part A premium. Medicare Part B, if you enter in a qualified special enrollment period, including the IEP, if you don't, your penalty is 10% of the monthly Part B premium amount for each full 12-month period enrollment is delayed. That can be substantial. Medicare Part D, if you enroll 63 days without creditable coverage after your employer plan ends, or any other individual plan ends, the penalty is 1% of the average Part D premium for each month you delayed enrollment. That's it's different every year. It's a special formula from the federal government, but it's like 3 or 4 cents per month. However, when that adds up to $3 or $4 a year, and if you, let's say you've skipped 5 years, right? That amount, $15, is added to your Part D premium when you do get Part D and never goes away. So it's an additional amount that goes with you. It's good to avoid. When can you change your coverage? Right now, we're about to enter the annual enrollment period, October 15th through December 7th. During this period, you can change plans, you can drop plans, you can switch from original Medicare to Advantage or vice versa. And the plans you select during this annual enrollment period will begin January 1st. There's a different kind of enrollment period, open enrollment, which is the following 3 months, January through the end of March. If you have an Advantage plan during this period, you can switch to another Advantage plan or switch back to original Medicare and get a drug plan. Whoops. That's the open enrollment period. There are many qualifying life event changes, which give you typically 2 months after that change, a special enrollment period. The most popular are moving. If you move out of your region or out of the state, you're given a couple of months to switch to that state's plan. Again, if you're leaving as a retiree, union, or COBRA coverage, you have a special enrollment period too, a couple of months to select a new plan. Saving money. There are preventative services that are free. There's a long list of them, and you'll see it in your enrollment guide once you get a plan. But some important ones to use are the bone mass measurement, mammograms, colonoscopies, vaccines like flu, hepatitis, pneumonia, COVID-19, those are all free. And there are another 20 different tests and programs that are free. So it's really, whoops, how did that skip? All right, we're back to saving money. So those preventative services are free, and I advise all my clients to get familiar with them and take advantage of them. I'm going to keep you healthy. It's better to use your provider network, and even if it allows you to see out-of-network physicians, there's often a penalty, a little bit of an extra charge in your copays. So use network physicians and hospitals if you can. Use as many generic rather than brand name drugs, and your pharmacy network or mail order pharmacy. The preferred one often can save you money on your copays. And it's worth looking at that and making sure that your status at the hospital is for treatment, not observation. So those are some of the ways that you can save money with your plans. There are extra financial assistance programs. I went over the Medicare Savings Program, which is comparable to Medicaid. It's also called Extra Help, which lowers your drug costs. Again, for people with lower incomes, these make a lot of sense. They're wonderful. And again, if you know people that have lower incomes, please have them get in touch with me or someone else and go over these special services. There are many places you can go for help. You can go to MedicareMadeClear.com, sign up for the newsletter. You can go to Facebook, to YouTube. You can visit Medicare.gov, which is a wonderful source for information on Medicare. You can call them up if you don't mind waiting on hold for a little while. And you can go to shiphelp.org, a state health insurance assistance program. You can contact your local Social Security or state Medicaid office. There's lots of sources of help for you. So thank you very much for bearing with me and going through this workshop and seminar. I want to give you my contact information, not only for you or for anybody else you think that might need some advice. I don't have to end up as their agent. I'm happy to give them information, and I've done that for years with the clients of Hammond Iles. So you can look at me as a resource as well. So my phone number, or you can text it, 860-550-0396. Email is rdcqed@cox.net. So that's my contact information. And now I'll turn it back to Stephanie to see if there are any questions that I might help with.
Hello, everyone. I am back. All right, so we do have a few questions for you, Rob. The first one is, why is that each time there is a cost of living adjustment to Social Security, most of it is lessened by an increase in the Medicare premium?
That's because somebody up there likes you. That's not always the case, but it has been recently because of inflation. The government, really wants to try to lower your costs in everything as much as they can. So I think the answer to that is it makes political sense for whoever's the president and in power at the time.
All right, so our next question is, if I choose Plan G, what will be the total cost? $230 for Part G plus $170 for Part B, is that correct?
Well, sort of. The cost for Part G from AARP is, let me get the exact cost. It's $231 a month. Plus you have that $226 annual deductible. There's no other cost in Part G. So that's it. There's no co-pays, no co-insurance. To get that plan, Part G, that's if you get it from AARP United Healthcare. The other companies will likely charge more than that. Almost all of them, if not all of them, will charge more. That's because AARP is the only group supplement in the state. But again, you can check with the state and look at, other costs other than AARP. The drug plans also vary tremendously. Even our drug plans, we have 3, and it depends normally on what your prescriptions are, which plan makes sense for you. There's a plan with a $30-some premium and copays, a plan with 70, and a plan with 110. So the premiums vary, the deductibles vary. So I can't give you an exact answer. It depends on what prescriptions you take. If you want to contact me or email me your prescriptions, I can pick the lowest cost plan for you, the best one, and give you an exact cost, including what your copays will be. But that's the best I can do in narrowing down your total cost. I wish it was simpler than that. I hope that helps.
Thank you, Rob. It doesn't look like there's any questions in the chat right now, so I'll leave it open for about a minute so everyone can type in some questions if you have any. And just wait a second, see if we get any more. All right. Well, If you are curious in other ways on how we can help here at Hammond Iles, we have our monthly financial power hours. Next month, you'll get an email with our next one, so stay tuned, everyone. If you can't make it to the live Zoom webinar or in our Vermont office or in Connecticut, recordings are always on YouTube channel, so check us out. Resources are available on our Hammond Iles website, hiwealth.com. You can follow, connect, like us on all of our social media. We have Facebook, Instagram, as well as Twitter. And call me to schedule a free conversation with a financial coach. I'm always here to help. But thank you, Rob. We really appreciate you presenting again for us today. It's been great having you.
Thank you, Stephanie, and thanks for all your help in putting this together.
Of course. All right, everyone, enjoy your day. Take care.